in my prior pregnancy, the OBGYN that I saw, because at that point I wasn't being treated regularly by a rheumatologist, the OBGYN that I saw basically scolded me for having gotten pregnant while having lupus, because she said that the chances of having a good outcome were very slim. And unfortunately for that pregnancy, she was right, but I don't know if that was because of the lupus or what, really. And unfortunately, I was so young at that point that I didn't feel empowered enough to seek out a second opinion or get better answers or understand more clearly what was happening and how I could be proactive in having a good pregnancy there.
The maternal fetal medicine doctor, I really remember her and her conversation, because she was just so sweet, so passionate, very thorough about everything and explaining everything to my husband and myself. But I remember her coming back again and saying, when she put her hand on my knee, and she was like, well, the risk is still great. Of course, she gave me all the risk factors, but then she was like, but I understand if this is something that you want to do, this is what you and your family have to decide. And regardless of your decision, we're going to be there to make sure we do what we can to keep things as safe as possible. We're going to do what we are supposed to do as doctors to make sure you get the best care.
I've been very lucky to have a really good team of doctors. I think it's that, as well as I myself have learned over the years to be an advocate for myself. And it probably wasn't more of a question of, can I have a child? It was more of, okay, I want to have a child, and we plan on starting, so what do I need to do to get me to that point? Especially with my rheumatologist, it was an easy enough conversation. We talked about the risks. Luckily, I was not on any medications at the time that would have been anything I would have needed to have gone off of. With my OBGYN, I had probably more difficulties with questions with them during pregnancy than before getting pregnant. My OBGYN was pretty good about it, and they knew that I saw a rheumatologist and had lupus, so it was just a matter of, again, making sure that when the time came that everybody communicated together about everything, so that we could try to have as safe and successful as a pregnancy as possible.
The more information you include, the better. There can be just that tiny thing that you're leaving out can be the one thing that the doctor needs. Like, oh, well, let's check this. And now all of a sudden we've answered all of your questions. And so I used to be that person, like, they don't want to hear me tell them everything. They don't need to know all of that. And then my doctor's like, yeah, I need to know everything. Tell it to me so that, and then she'll say, or he'll say, that's not that important, or that's normal, or they'll tell you why you may be feeling that symptom, or, whatever. But if you don't say anything, you don't know. You're left wondering, and then you go online and you're looking up things and you're getting misinformation when you've got the jackpot sitting right in front of you. Just use your resource. You have to tell them.